All right, so welcome to the McLean Hospital Crafting Support Project 2024 Family Webinar Series. I'm Dr. Julie McCarthy, and I'm a clinical psychologist and researcher at McLean Hospital. And tonight, I'm very excited to have you with us for a presentation on recovery with peer specialists with one of our wonderful certified peer specialists at McLean Hospital, Steve Fedele. And before we begin, I'll just go over a few reminders. So please enter any questions you would like answered in the Q&A box, and we'll be answering questions primarily during the second half of the presentation. And we ask that you do use the polls and chat for our audience participation and to share any comments, resources, etc., that you might like to share. And we are recording this webinar, and we'll let you know when the recordings from this year's webinars are available. And to continue to improve the webinar series, we encourage you to complete our brief, anonymous, and voluntary feedback survey to share your thoughts, preferences, and ideas for future webinars, so we make sure that it stays relevant for you. And this information helps us for quality improvement and may be shared anonymously in the future with researchers or other people who work with us who are interested in expanding support for family services. So I will put that link in the chat in case anyone needs to leave early. Okay. All right, so first up, we will be going over the introductory agenda. So first, if you're new to our webinar series, welcome. I'll be talking a bit about what our crafting support project is. Then we'll dive into the presentation with Steve on recovery with peer specialists. And then he and I will take some time in the second half of our presentation to really do a Q&A, invite questions from the audience, and I have some questions prepared as well. And then we'll end with some closing remarks and some resources. All right, so first up, the crafting support project itself. Before we dive into what that is, let's just check in on who we have with us tonight. So I'm going to launch a quick poll, and we are going to ask you to just share a little bit about, your role in terms of your interest in joining us tonight. So the question is, what best describes your role? Family member, person with lived experience with mental health challenges or conditions, clinician, none of the above, or perhaps you have intersecting roles with some of these identities as well. And we'll give folks a few more seconds to fill this out if you would like. Completely voluntary. All right, and we'll close this in 3, 2, 1. And tonight, hopefully you can see the results. We have about 92% of our audience are family members. 8% are people with lived experience with mental health challenges themselves. And we also have 8% in terms of clinician roles. Okay, so why are we all here tonight? So the work that I do as a clinical psychologist at McLean Hospital also entails doing research. And through the work that I do with community reinforcement and family training or craft, I work with a lot of family members on support for people who have loved ones with early psychosis and substance use specifically. What we learned, though, is that a lot of people want this support who might not be eligible for that particular project, or they may have gone through that research study and maybe didn't get the individualized intervention support that they were looking for. And so we were trying to find additional ways to help support these families that we were working with to get evidence-based skills and knowledge that could be helpful for themselves and their loved ones. And so we were very fortunate to get philanthropy support through our Division of Psychotic Disorders at McLean Hospital to offer this set of services for families who have a loved one with psychosis, but really family members of anyone navigating mental health recovery. So our family webinar series, as you are already well aware, occur on Thursdays from 5 to 6 p.m. And this is really for the broader community. We've had a couple of webinars so far, and we are in our second year now. And we have our topic on peer specialists tonight, and we have a number of great topics coming up that are relevant in terms of how families can best support their loved ones, what we can do in terms of noticing when people need help, think about what would be useful for us to know in terms of our perspective as family members, clinicians, people with lived experience with mental health ourselves, and a bit about medications as well for psychosis specifically. And then we'll end this year with a family recovery night, sharing stories of hope from the perspective of people with lived experience and their family members to share both sides of the recovery story. All right. And if you have not been with us last year, when we first started this webinar series, we do have recordings on many of those webinars online. So feel free to check those out. And for folks who are McLean families, either now or in the past, who have come through our Division of Psychotic Disorders specifically, we also do offer one-on-one coaching at no cost for folks. So if people are interested in that, feel free to get in touch with me. And this is for people who aren't eligible to get coaching through our research study, or people who have completed that who were unable to get coaching at that time. Okay, oh, and we have a question in the chat about showing the YouTube link again. So the page online that you would be looking for on YouTube would be Crafting Support Project. And there should be a number of videos listed on there currently. All right, so before we move to our main event tonight, I'm going to launch another poll, just trying to gauge people's familiarity with what peer specialists are. So let me launch that one. And so the question is, how familiar are you with peer specialists? 0, unfamiliar, you're new to this idea. 1, minimally, you've heard the term peer specialist before this webinar, but maybe that's about it. 2, moderately, you've read or learned some details about peer specialist work. Or 3, very familiar. Maybe you've had personal experience already having engaged in peer specialist services, or maybe you have a loved one who has. Okay, so I'll give folks a few more seconds to respond if you would like. Okay, and we'll close the poll in 3, 2, 1, and sharing the results now. It seems like the majority of our audience tonight, 47%, are pretty unfamiliar with peer specialists. So you are in the right place. We have 21% who are minimally familiar. They've heard the term peer specialist before. 16% are moderately familiar, and then 16% have actually engaged in peer specialist services before. So from wherever you're coming from today, thank you so much for joining us. All right, so I am very pleased to introduce our speaker for tonight, who is one of our leading certified peer specialists at McLean Hospital, Steve Fedele. He's been a peer specialist at McLean Hospital since 2017, and he coordinates what we call our Well Space program, where they provide therapeutic and supportive groups for young adults ages 18 to 30, along with supported education and employment services that people can get one-on-one as well. And so he started with mental health writing and lecturing, which led him to some of the peer work that he's doing now. And currently he works across our inpatient, outpatient, and residential settings at McLean Hospital and works as a vocational specialist as well. And he's involved in writing for a number of publications around fiction, mental health, and in papers in medical journals too. And so he provides in-services, kind of trainings throughout the hospital and within the greater Boston area. He also teaches within the Harvard Medical School residency training program. So please join me in welcoming Steve Fedele.
Hi, Julie. Thank you for thank you for having me here tonight. I'm honored to be here and excited to be here. And I'll do the screen share now, so I'll get the slides up, and yeah, we'll share a little bit more about peer work. And I'll probably speak for like 20 to 25 minutes about peer work. And afterwards, we'll have a question and answer session where through the chat, we can, kind of touch upon, more questions people might have. So start with this. Peer support. So the work of certified peer specialists. Just to start, you might hear a lot about peer support. The word peer can be used interchangeably where, people will mention like, oh, I received peer mentoring or peer coaching, which can be from someone who has similar standing in the community of having experience with a mental health condition or lived experience, or being a parent of someone or a family member of someone with lived experience. So yeah, the word peer does get used interchangeably, which I think is great. I think we all have experience in, within the mental health world, or, we're peers in many different ways to each other. But I guess to, create a delineation, the work of certified peer specialists, which, can be the work of peer support in a number of instances too, is, through a certification, class and through specific training, and we'll talk about that in just a little bit. So let me just see. Okay, so the agenda, I guess, we'll talk a little about the CPS Code of Ethics and modalities of practice. So just different elements of peer support that are helpful to know about, ways that peers are providing care, and what's unique to peer support, which is, sets it apart from other kinds of support, whether it's clinical, whether it's psychopharmacology, whether it's therapy, whether it's group work, and to really get a sense of like, where is the value in peer work and what is the difference it's going to make to either myself or, the loved one that I care for, or, someone you might know. So we'll talk about that. We'll talk a little bit about advocacy, peers as teachers, peers in research. I think part of what I'd like to convey tonight is all the different elements of peer work, along with the value of direct care of peer-to-peer support. So like incorporating all those different themes within this talk. And I think just to chat a little about the history of peer support, in the late 18th century, peer support actually started in a hospital in France, where the director of the hospital found that peer support was a lot more helpful to clients. There was just a lot more humanity to it, and there was a knowledge base that was helpful. Intermittently, peer support came about over 2 centuries, and then in the 1970s, there is the consumer movement, where people with lived experience started to create better movements for better quality of care for individuals with lived experience. There were different things happening in mental health care that weren't as ethical, and people were coming out of the mental health system with difficult experiences. So that's partly where the modern day peer movement originated, is in the 1970s, and it evolved to where it is today. So that's a little bit of the history of it. So I'm going to read these couple parts because I think they're really important just to hear, and then I'll give you a little more information about them. A certified peer specialist is someone with lived experience within their own mental health recovery, who has undergone training to use that lived experience in a positive and productive way to inspire hope and to support others with similar experiences. We promote hope, personal responsibility, empowerment, education, and self-determination in the communities where we serve. CPSs are trained to assist others in skill building, problem solving, setting up and maintaining self-help, mutual support groups, and building self-directed recovery tools. A critical role of the CPS is supporting others in developing their recovery goals and specific steps to reach those goals. So that's a lot, right? You hear a lot there, and we'll get into the different, the different elements of peer work in a little bit. I think one of the major things to be aware of is peer specialists are certified and we are trained. I'll jump forward a bit. There's a certification class. It exists in most states in the United States, and it exists overseas as well. There, in a number of countries throughout the world, there's peer support. There's actually, peer support, goes beyond the US. Last I heard, it's close to 40 out of the 50 states having peer support, but so each state kind of has a different certification process. There isn't really a unifying entity in the United States between the different states, so each state has a different way of completing the certification course and different requirements. In Massachusetts, it's sponsored through, they're called the Kiva Centers. They were originally the Transformation Center, and, just kind of evolved to the Kiva Center. So there's a 50-hour course with a 3-hour certification exam. Continuing education is really imperative for this work. We do, we do a lot of work in continuing education with specialty trainings, with ongoing supervision. If you're unfamiliar with psychological services, as providers, whether you're a clinician, so whether you're like a social worker, a doctor, a psychiatrist, whoever, there's something called supervision, where we meet with a peer and sometimes our direct supervisor to gain support and resources and to learn, typically weekly, sometimes every other week, or, you know, it varies how people schedule it, but to just keep learning about the work and to keep learning about how to improve. And also, you know, mental health work can be intense work. So to process some of the experiences and gain support for providing support. So there is what's called clinical supervision, where a peer specialist will meet with a clinician, which can be incredibly helpful. I mean, I know there are different advocacies between clinical supervision and peer supervision in the literature and in, you know, throughout the country. I tend to find both are really helpful. I have an awesome clinical supervisor as well as an, you know, an amazing peer supervisor, and I learn different things from each person. And some of the same things too, you know, I mean, there's a lot of crossover between clinical and peer specialist services, and then there's, you know, differences as well that are important to be aware of. But yeah, I think clinical and peer supervision are both incredibly helpful. And I think the thing to be aware of in the peer certification process and in the knowledge base and the expertise, or just, you know, the value that peers hold. I like the word value. I think, you know, I like a beginner's mentality. So, but I think informal education, you know, I've dealt with my mental health condition for over 18 years, and dealing with something every single day of your life for 18 years and working through it to get to a point of having a really healthy and happy life. Like, you know, there's myriad instances of wisdom, of problem solving, of logistics, of just understanding and going through an experience that doesn't get quantified in an education or in like a bachelor's degree or in you know, a doctorate. But you know, that knowledge is there, and that has a unique value that can't always be quantified in formal education. The informal education of lived experience is one of the most valuable things peer specialists have. Going through something and being able to talk about it in an eloquent and considerate way, in ways that inspire hope and support people in learning and growing, like, you know, that it's a really amazing thing. So that's just something I would like to express. Let me just see. Okay. So the core competencies, this is through the Kiva Centers in Massachusetts, which this can vary. You know, a lot of these core competencies are, I don't want to say ubiquitous across, I'd say they're fairly, you know, like they're fairly, there's a lot of crossover. So there is a code of ethics, you know, as there is with every profession, as, you know, just, you know, morals and ethics of providing care, and, you know, the dynamics of the relationships, and, you know, do's and don'ts of the work, like all that kind of stuff. So we're, you know, we're versed in those things and strongly ethical people. You know, one thing I really want to highlight um, about peer specialist work is creating the life one wants, um, along with mutuality at the same time. As a peer specialist, I'm not making decisions for anyone. I'm not guiding people in a direction that I want them to go. I'm not trying to make things happen for an individual. As a peer, I'm someone who listens and supports and sometimes guides, but in a way that the person wants to be guided. So we believe in self-determination, which like clinical services do too. This isn't entirely unique to peer work, you know, but basically we're further steeped in this, where, you know, we don't have power dynamics with individuals. We sit on an equal standing. So we don't section anyone. We don't typically take medical notes depending on the setting. Here, we typically don't, you know, and we're trying to be on equal footing as much as possible, to share our experience, to support someone in figuring out what they want to do with their life, what will help them to create the life they want, in ways that they can figure out things for themselves and make their own decisions and go their own path. You know, so we're supporting people in figuring out what that is, and asking open-ended questions and sharing our own anecdotes. And I think a really essential part to this, which this is just a life lesson, I think that's important to realize, is that, you know, every individual is different. You know, I remember starting peer work and I was like, oh, my recovery's got to be similar to everyone else's, or there are parallels. But I think as I've grown and evolved in this work, I realize how unique every individual is, and to really honor that and to not project or convey my experience onto someone else's as if their path should be my path, because we're different people, we have different lives, there might be some parallels, but I think, you know, that's where walking alongside people is really valuable, is being together and with, and we're always with the person and on their side and supporting them and learning and growing. And in my experience, the personal growth and the learning and you know, the recovery comes from you know, just yeah, from the, sorry, I'm repeating myself, but from the personal growth, from the learning of the difficult life experiences, just in life in general. So, you know, I think a part of our work is we share about our lives every day. Sharing about our lived experiences, you know, our lived experience is essentially what we draw from. And then from other places we learn too, we can share, you know, things we've learned, read about, you know, any number of things we learned from trainings, sharing our recovery stories as well. You know, a lot of peers will convey the recovery story is one of the most powerful tools they have to support and educate other people in their mental health recovery. Basically, you know, hearing someone's recovery story can be a really powerful thing. You know, it's grounded in the life experiences and hearing the full story rather than just I recovered. You know, there's a lot of power to that. It's inspiring. It gave me a lot of hope when I started hearing more recovery stories. So, you know, just sorting through these things as well. Human experience language is another part of this. So, peers have um, different kind of practices with human experience language. I tend to use the language that someone prefers. Some peers might only use human experience language, whereas, you know, using solely clinical language wouldn't be as peer oriented. So human experience language is basically just talking about psychological and psychiatric terms in everyday language. The importance of this is the identity that it helps people create. Um, you know, language is a really powerful tool in how we develop concepts and ideas, how we think about ourselves, how we think about the world. So, you know, using language that is hopeful, using language that is not disparaging or detrimental when talking about someone's life or a mental health condition can help shape their identity. So regardless of whether it's human experience language or clinical language, it can be really helpful to use language that has a positive connotation, that has a positive meaning as well, and that moves in a positive direction. So, you know, to say someone has a mental illness, like the word illness can have a really negative connotation. Like illness typically means someone's not doing well and they're struggling, and the connotation is like the meaning surrounding the word, whereas the denotation is the exact meaning. Whereas when we think about a mental health condition and phrasing it that way, like this isn't who I am. I have a condition. It's just something I go through. It doesn't define me. I don't experience it all day, every day. There are moments and spurts where I experience it. In the beginning, I experienced it more throughout the day, but you know, I think just talking about ourselves in a positive way, which is partly what human experience language does, and in an everyday way too, like in everyday terms, because using too much psychiatric language for me can sometimes create stigma and self-stigma towards myself. Whereas at this point, I think of myself in terms of who I am, in terms of my life, my family, my friends, um, you know, other elements of my life, not in terms of I have this mental health condition. The condition's not who I am. So that's a really important part of what human experience language is trying to accomplish. Um, Advocacy, I'll get into a little bit later, and teaching. Yeah, and I think just sharing resources and tools, strategies and insights, listening to people, you know, something really powerful, you know, which dates back thousands of years and a number of practices, healing and learning and growth practices, especially Buddhism, is listening, like being a really good listener and just allowing someone to share what they're thinking without judgment, without trying to guide them one way or another, and to just hear and witness what someone is saying. Like that's a really powerful part about being with someone and just sitting with someone and being together and allowing them to share the things they need to share and to figure out the things they need to figure out. And it, without control, without, just witnessing and hearing and not judging the person and being a good listener. That's really essential to peer work. I think there are different advantages of peer specialist work, and I'll probably go till 5:35 just to bookmark that. But so being a beacon of hope, I know in my own recovery, like there were a lot of times where, I had different thoughts about whether I'd live or not live, and, having hopefulness. There's research indicating that, like, there were a lot of times in my recovery where I didn't know how well I was going to do, but other people had hope for me. Other people were like, you can do this, you can get healthier, you can recover, when I didn't always believe in it. And that's what helped me to get through some of those difficult moments. And that's what peer support specialists can provide too. Or anyone can provide this who's been through a mental health condition. It doesn't have to be a peer specialist, but just sharing with someone, I've been through this, I'm living a life where I'm doing all right, you can get through this. Even the research indicates, regardless of where someone starts in their mental health recovery journey, and regardless of the severity of the condition, one of the main determinants and outcomes was the level of hopefulness people had. Aside from, so hope is an incredibly powerful thing. It gives us courage, it gives us motivation, it's who we are as people. So I can't emphasize that enough. I've talked about the firsthand experience with mental health symptoms. And I think having that firsthand experience, there are different strategies and methods and ways of problem solving, mental health issues or conditions, or just the everyday life. Living life with a mental health condition is different. Dealing with the stigma, dealing with the way people talk to us, dealing with, it's intense dealing with stigma, and then dealing with our own self-stigma and how to, expunge that and to not feel that way about ourselves, to see ourselves as the equals we are to everyone else. That can take time to develop and to, really see that clearly, to see the truth in that exists. So, peer specialists can be helpful with that. I think these next two slides, settings for peer work and roles within peer work, kind of work together. So, within psychiatric settings, peers are outpatient, inpatient, they're in residential care, assertive community treatment team, which you may or may not have heard of. It's a team consisting of a clinical team and peer specialists as well, who meet people out in the community to work together and to support people in their life goals and recovery goals. Excuse me. Community organizations, peers work in research, government advocacy organizations. RLC stands for Recovery Learning Center. So there are different centers and locations, peer respites as well, that are allocated just as peer centers and as non-clinical spaces. And I think, there are a lot of non-clinical spaces such as recovery learning centers and the Hearing Voices movement and peer respites that can be helpful to individuals. Sometimes people, even in today's world, haven't had a great experience with the psychiatric system, or they're not looking for clinical support. They're looking for a different kind of support, such as peer support, that can really help them through the difficult times and to move forward, just as clinical support does too. But, I think it's just subjective to the individual. Some people prefer peer support. Some people prefer clinical support. Sometimes clinical support is better versed in, in some ways of treatment, whereas peer support has other methods too. And I don't think one is better than the other. I think they complement each other. And there's just like different practices and skills and abilities and value that you can get from either or. And I tend to use both. I remember the first time I met with a peer specialist, I was like, this is really powerful because I've never thought certain things in my life were possible. This was a few years back, but meeting someone who like is living a life similar to how I want my life to be, like that created a lot of hope for me. That created a lot of movement internally. That's a lot different than hearing someone say that, oh, you'll get better and you'll recover. I believe in you, which is powerful. But hearing it from someone who's been through it has a different level of efficacy. So I think practices of peer work as well, kind of bouncing around in different places, so I apologize for that. But peers meeting individually with person served, or you might call them a patient or a client. There are different words for it. Group facilitation. A milieu is just like a general setting that, like the hallways of a mental health unit would be a milieu. So like, chatting with people, helping them with different things in their day, giving them resources, supporting them in a number of ways, social interactions, just being social with people as well. The being with, I think, is really important. Sometimes people aren't in a space where they want to talk when they're in their mental health recovery, and to just sit with them and to be together, and for someone to know you're there by their side and you want them to get better, and you're just going to sit with them and be with them and witness what they're going through. That can be a really powerful thing, to know someone's there with you. So listening and reflecting, and we've covered these other two, sharing our experience and our stories. So a little bit about this, roles within peer work. Peers do coordinate and lead programs. I coordinate a program. There are other peers throughout Massachusetts and the country and the world who coordinate mental health programs. So it's important to realize, there is upward movement. Peers, as egalitarian as we like to be, we also do, hold these standings. There are different roles peers take within research. I work within research, as well as there are other folks who work within research. We'll get to that a little bit later on. Teaching, you can just look through some of the different things here that peers do. So we'll just skip through that. I think the advocacy slide. So there is a lot of research on this. 3 forms of breaking down stigma and of creating better equality, or helping people to see the equality, is the way I like to put it. The equality is there. It's just a matter of seeing it. Contact, education, and social activism or protest. So contact and education or research to be partly the most effective ways of advocacy and of, standing up to stigma and other forms of discrimination. So, when you interact with someone who has a different orientation than you in the world, I think over time, you begin to realize, we're all, we have a lot of similarities, and we're, I'm the same as the person with the mental health condition. And it breaks down your biases and your stigmas, just interacting with people from all different walks of life. So that's a bit about, contact and like the being with, and, just talking and making friends with people and learning about people's life stories and who they are. We tend to think we're so much different, where we have so many similarities too. So education, this is like formal education, seminars on stigma, teaching sessions, education on life experiences. I think social activism, this would be, just advocating within the public sector, or the legislative sector for law changes and other forms of legal changes, and different things that help to break down structural stigma that exists within society. So there is a research study about sharing recovery stories. This was for clinical providers. So when peer specialists or people with lived experience shared their recovery stories with inpatient staff, this was formally assessed and researched in a qualitative way. So they took people's spoken responses and written responses. They found, the levels of humanity and understanding that were developed for the clientele who were staying on the inpatient units that were being assessed, like, rose dramatically. And there were a lot of qualitative responses of like how much people learned and their levels of hopefulness that, people with mental health conditions can and will recover and lead full lives and lead meaningful and productive lives. So, I mean, that's formally researched. That's something we know as well, but just to share that. So, yeah, there are different teaching roles for peer specialists that we have here. Let me just check through my slides because I'm taking up a lot of time. If there's anything in particular. There is a lot, but I will go through it quickly. So there's trainee facing. We teach a lot of the trainees in the hospital. We teach fellow staff on a number of things. There's service user facing as well, as you can look through some of these slides and look through the webinar, to read through a little bit more. There are a number of things happening at McLean Hospital for teaching. Peers teach in a number of settings, in a number of ways. So it's been and this is beyond McLean. This is in, any number of recovery settings. So I think, these are some different research studies that I have a little bit written about. And I am just kind of getting through these slides. So this is, I guess one interesting thing, a lot of the supervision and peer teaching formally started at the University of Toronto with Sasha Agarwal and a client he had, who she came to a point of realizing, like, why is all the learning coming from the psychiatrist when she knew so much more and so many more things about what she had been through? So they switched up, the way they were doing the teaching. She was paired with senior residents as advisors, and then they started to realize, like, this has tremendous value. And, at McLean, we've picked up from their research, and, we have similar sessions, process rounds during inpatient rotation, open discussion formats, and a number of things. So peers as researchers, I think, translational research indicates when someone with lived experience starts at the beginning of the research project as a vested partner in the process, whether conducting the research or sharing, there's a higher level of humanity, and it changes the outcomes and the understanding in all the phases of research. And this goes beyond mental health research. This is in many other forms of medicine as well. So, you could read through this at another time, just different initiatives here at McLean and MGH for peer research. And I think my main takeaways today are currently in the research world. Peer work is being assessed for efficacy and best practices. We know it's effective, but it's more so, there's a notion in research that you try to quantify the extent to which something is effective and the particular nuances of that efficacy. So you can gain a better understanding of it and how to create best practices and implement it. Peer, we know from persons served or clients or myself. I'm also a client, but I don't know if I even identify in that way, but I go to therapy, I take medications, whatever. So, this is making a big difference in people's lives. We see it in the work that we're doing. We see it in the results people are having from attending our programs, from, any number of things, any number of markers of wellness. Like it's happening. It's helpful. And I think, something that remains somewhat unwritten in the literature is that I think the skillfulness of the practitioner, of the peer specialist, of whoever, whether it's a psychiatrist or whoever, is one of the main determinants of levels of efficacy and helpfulness to persons served and in the community, just as in all other healthcare professions. It's as in anything, it might not come down to the modality. We have a sense the modality is working, being that it's been in place for a number of years, but like part of it does come down to being, the quality of the person providing the care will determine the quality of care. So with that, these are my citations, and I will turn it over to Julie.
There you go. Thank you so much for that wonderful presentation. And so now we will move to our Q&A section with you. So for any of you in the audience, please feel free, if you haven't already, please put your questions in the Q&A. So one of the first questions that we have is, within the McLean community, what specialties do the certified peer specialists work with?
Could you specify a little more? What do you mean by
Yeah, I
specialties?
think
Yeah.
maybe, how we have different divisions or maybe different clinics or programs, for instance, you and I work in the division of psychotic disorders.
Mhm.
What other specialties might people be able to interact with certified peer specialists about, even beyond our division, perhaps?
Yeah, that's helpful. So through the Peer and Family Services Center, where peers have the ability to visit different units, outside of the division, peers in the psychotic disorders division too. So there are peers in the anxiety and, Julie, what's the exact name of that division? The
Depression and anxiety,
Depression and
maybe?
Anxiety division. Yeah, sorry.
No worries.
Yeah, thanks. So in that division, they have their own peer program that they're beginning to develop. And we all work cohesively too. We all meet together and, help each other out. The psychotic disorders division is probably where there's the most prevalence and where it was started by Waverly Place, which is a peer-led program, that's existed for a number of years, and we're really some of the pathfinders and like getting the peer movement started at McLean Hospital and sustaining its origins. So, it's been around for a number of years, over 10 to 15 years at least. But the peers, there are peers in the OCD division, supporting people dealing with OCD, in the geriatrics, in trauma-informed care, dissociative identity disorder.
Mhm.
Like the goal, there is a vision in the hospital that at some point there would be a peer specialist available for every unit and every clinic, which, you know, there's been a lot of support from the entire hospital to make that happen. Some of it's just logistical, but it's a vision and it's a shared goal, for everyone here. And, we're working towards that, where there's a lot of work to do. But yeah.
I think you're right. Thank you for sharing. And I think somebody also put in the chat, in addition to the CBI, we also have folks in our alcohol, drug, and addiction division as well. So thanks for some of those examples. And so if someone wants to engage with someone who is a certified peer specialist, how would they go about doing that?
Yeah. Different programs, different divisions have different programs. So like in the psychotic disorders division, we have Well Space, which is a program I coordinate, and we have a number of great employees and 2 peer specialists that folks can meet with, myself and another peer.
Mhm.
I think there are peers becoming increasingly more available on the inpatient units, as people come into the hospital and are, going through, that experience of working through the inpatient stay. The Peer and Family Services Center has had the ability to go to different units. They also serve as a drop-in center. So
Mhm.
if you're needing to meet with a peer, you can drop into the Peer and Family Services Center, and there are peers available there who can meet with you and check in,
That's
and
wonderful.
support you in different ways if you're looking for a check-in that way.
Quick follow-up
Um,
question to that. Do you know if that type of peer support is limited to people ages 18 or 30, or open to all ages? Because I know, I had mentioned WellSpace has a certain, serves a certain clientele. And so do you happen to know for that drop-in service, if you mentioned, if there are any restrictions around that?
Not that I'm aware of. I
Okay.
mean, my sense is it is 18 and older. Yeah, that I'm mostly certain about that, like 97%, we'll say.
Okay, sounds good.
Yeah, I'm pretty sure. Yeah, you can just check in with them and they'll let you know.
Wonderful.
Yeah.
And so a couple people asked, is this service covered by health insurance, specifically something like Mass Health? Um, Thoughts there?
Yeah, so within the hospital, peer work is mostly funded philanthropically,
Mhm.
which we're incredibly grateful to all the people who've supported us and continue to be grateful. Like, it means a lot, and it's been such a great resource. Peer support has been such a great resource for so many people.
Mhm.
That is one of the barriers to peer support expanding, is that, it's not reimbursable through insurance yet, which is something that's happening on the advocacy level. People are
Mhm.
searching for different ways to make it feasible in Massachusetts. There's been different discrepancies with like how to make that happen, what works, and I think the goal is to make it work for everyone, which
Mhm.
like there have been differences of opinion and back and forth conversations. So that's currently one of the dilemmas. I think at some point in the future it will be established. It is established in other states where it's reimbursable through insurance,
Mhm. Mhm.
but each state is different. There's no overarching certification board for peer specialists or like organization that kind of connects all the states and kind of unifies everyone. So that's part of the reason. And I don't know particularly which states, but there are states that it's reimbursable. So it's happened and it can happen. It's just going to take more time and more work. So that's kind of where it's at. Yeah.
So we might be on that path. Okay, thank you.
Yeah,
And
we're on that path definitely.
yeah,
But yeah, it'll just take time, I think.
of course. And so someone asks, is there support or guidance or training for clinic settings that want to hire peer support specialists or certified peer specialists, in terms of how to deal with maybe developing philanthropic support if it's not insurance based, or thinking about liability, et cetera?
Yeah, my sense of this is a lot of it's just networking. Like,
Mm-hmm.
I've networked with different places to support them in
Yeah.
peer work and getting peer work established as other peer specialists do too. I think a
Mm-hmm.
lot of it's just like networking and communicating and having regular check-ins with peer programs and different establishments that already are hosting peer work and just, you know, developing it as you go.
Mm-hmm.
That can be it is a developing profession. So I think that's one of the interesting parts to it, where like from organization to organization, there are different ways that peer support is provided. And then
Mm-hmm.
based upon whether it's a peer-led organization versus a peer-led program within a healthcare organization versus just
Mm-hmm.
like peers within a healthcare organization, there are different
Mm-hmm.
distinctions, and each place kind of has its own unique culture and way of doing things, which is kind of cool. It
Yeah.
partly fits the culture, and I think in the end of the day, it's about what's most helpful to, we want everyone in healthcare, providing healthcare to feel good, but what is also simultaneously most effective for people, getting, receiving services. So,
Right.
yeah.
So, in terms of receiving services, several people have asked about how do I find a peer specialist, maybe for my loved one or outside of McLean, where does one find a peer specialist? So, what thoughts do you have there about resources that could be of interest to folks?
Yeah, there are different peer-led programs throughout the state in a number of healthcare organizations.
Mhm.
I think in particular, just networking to check in with whether the organization you're working through like has peer support. There
Mhm.
are, yeah, I think there isn't really a central hub. One place to potentially check would be Kiva Center's website.
I was thinking
They
that
might
too.
have
I'll
something
put that in the
there.
chat again.
I'd have
Yeah,
to look at the website again, but
they
that could
do
be a good place to
have
start.
they
Yeah.
do have peer support groups, for instance, or sometimes individual support services as well. And when available, sometimes those respite centers that you had mentioned where people can go. Um,
I think in addition to,
yeah,
yeah, that kind of rings a bell for me.
yeah,
Yeah, so they have those groups, and then Wildflower Alliance also has groups
mhm.
there in Western Mass. And if you Google Wildflower Alliance, you should be able to find them.
I'll
And
pop that in the chat as well.
yeah.
Okay, great. And so I think you had kind of alluded to this. Yes, these services are available on an outpatient basis often. And so let's see, how does one qualify to get trained if there is, a qualification, I suppose, before you get started with the certification process?
Yeah, I think to give you a sense from Massachusetts is, at least, I don't want to speak for, I can speak for Massachusetts and like what I know. A lot of it is like you need to have had firsthand experience with a serious mental health condition.
Mhm,
In like mental health research, there's an acronym SMI for serious mental illness, but
mhm,
I prefer, it's just a condition in my mind. But like, yeah, so having experience with having been through something, but then also having experience in recovery and being in a place where you've done some learning and growth, and you can be in a position to be a support to someone else as well. I mean,
mhm,
there is a really cool part of peer support, which like there's research on this, but beyond the research, just the peers I know and in my own experience, I've improved so much in my mental health recovery and in just my general health and knowledge as a person. Being a peer specialist, like the work, there's a lot of growth and evolution as a person
mhm.
that we all go through as peer specialists. So like, you know, it's like it's a really powerful and healing practice, and I've found it really central to my mental health recovery and really bolstering my mental health recovery. But
Mhm.
yeah, so they tend to, make sure you kind of have, at least elements of those criteria. And then
Sure.
I think as well, taking to register for the peer certification or to at least apply, they would like to see at least 2 to 3 specialty trainings, which are available through checking in at the Kiva centers to figure out like what are peer specialty trainings, and then any kind of credentials you have in psychology, whether if you have a bachelor's, if you have a master's, if you have taken different trainings and different courses, or you've been worked in a mental health as a mental health worker in some capacity before, like all that kind of stuff, just putting a resume
Yeah,
together specific to that. And like that can all
sure.
be helpful too to get into the certification class.
That sounds great. Thank you. And so some folks were asking about, McLean peer specialist specifically. So I did put the well space link
Hmm.
on the MapNet website in the chat. I'm also going to put in our McLean Hospital Crafting Support Project resources file in the chat where Steve, you had mentioned our um, peer and family support services. So we have a contact there as well, Joanne Grady Sabard, who folks can email if they have questions for certified peer specialist work outside of our division too. And so somebody asks about, you know, how would you talk to someone who doesn't want to seek the help of a doctor per se? Someone who may have had a history with manic episodes in the past, with psychosis, also maybe using cannabis as well, and you know, sort of someone who might be at a place where they realize they might need help but want to do it their own way. And so I guess this might be a question of, what could a family member say or do in that position? And maybe thinking of peer specialists as a potential resource that's not a doctor or a formal clinician. How might you recommend broaching that conversation with a loved one?
Yeah, I think on the crafting webinar series, there's a segment coming up. I think it was in 2 sessions on motivational interviewing.
I think it's
And
next month,
oh, it's
actually.
next.
Yes.
Yeah,
Mhm.
yeah. You know, motivational interviewing, I think a lot of it, what I experience, and I provide a lot of first episode care. So like after someone, working with a lot of folks who are within the 18 to 30 range, who, young adults, there can be a lot of situations where people, young adults they're trying to individuate or kind of create their own path in life, and then they're not wanting to be told one way or another of what to do. So there are
Mhm.
like particular ways to like, just share that something exists and is available for someone if they're wanting it, but to not make that decision for someone or try to like emotionally kind of guide someone in that direction while trying to objectively present it. I think a lot of it is like the emotions of
Mhm.
MI are just as important as the the principles of MI and like the way you let people make their own decisions. But yeah, I think this is a really powerful thing I've learned over time working with so many young adults. When someone wants to make a change in their life, like the research and change theory indicates they're 76% more likely to make a decision that's their own than that is someone else's. So
Mhm.
like not making decisions for someone, one way to do it would be like, hey, I know you're thinking about this. There's this resource that you could consider, and to just give them information on it and let them read about it and do it on
Yeah.
their own. I think in my own recovery, one of the most frustrating things in the beginning, a lot of people came from a really caring vantage point, but like people trying to get me to do things, a number of people, it just got way too exhausting and confusing. And I just didn't want to hear about it from anyone. That was my
Yeah.
own story personally, which I
Mhm.
know a lot of people have parallels to that. So I think just like sharing like, hey, this thing exists and it's your choice. And
I think you're
I
highlighting the
understood,
self-determination element of your
yeah,
talk. Yeah.
I think it goes beyond recovery oriented principles too. I think
Mhm.
the right to just like live your own life. I think of it more as like a human
Mhm.
right, that it's like I
Sure.
don't want to make decisions for people.
Yeah.
How do I know what's best for someone? Like I might have ideas and I
Mhm.
can share those ideas, but like people need to make their own mistakes and live their own lives too. Like I believe in
Sure.
that.
Yeah. Okay. Well, thank
Yeah.
you for sharing. And a couple other quick questions, and then we'll turn to our closing comments in a moment. Do you know, are peer specialists kind of practicing in private practice per se? And if so, how might someone find one?
They're not supposed to be.
Okay. Good to know. So that answers
So
that.
you might find one or two who are doing so. I've heard of it happening, but by
Gotcha.
state certification guidelines, you're not supposed to practice individually.
Okay.
Um,
That makes sense.
yeah, that's not
And
supposed to be happening.
And also, how would you say something like AA, Alcoholics Anonymous, for those less familiar with the acronym, relates to peer support in your mind?
Yeah, there are so many parallels. I haven't been to AA. What was the other one again, Julie?
Oh,
AA.
just how does AA relate to peer support? But there are other things like AA, NA, Narcotics Anonymous, Smart Recovery is another model as well.
Yeah, I've heard enough about the different modalities that like
Mm-hmm.
exist. I think a lot of it does have the mentality of like you hear from someone who's going through similar experiences or who has been through similar experiences,
Mm-hmm.
and there's a lot of like mutual learning and personal growth.
Mm-hmm.
Um, and then there are different orientations for it. Like I know some modalities are like really focused on using religious supports or spiritual supports or other
Sure.
supports. And then others are kind of non-denominational or non-ascribing. It
Mm-hmm.
varies per person. Some people find religion to be really powerful in their recovery, where others are like, that doesn't feel as helpful. And I like other avenues for mental health recovery. So I
Mm-hmm.
think, yeah, it's very individual what works per person. But those I've heard, they've existed for a number of years because they're working.
Sure.
And
Okay.
it doesn't work for everyone. They're like, I think every kind of modality, whether it's peer support, clinical support, like, even from time to time might work differently per person, per like place they are in their life.
Right.
Someone might not be ready for clinical support or peer support, and then
Mm-hmm.
they evolve or not evolve, but they just move forward in life and reach a
Yeah.
point where they're wanting support, but
Mhm.
it's all different kind of.
Very individualized, and it's nice to have options. Well, I think that's all we have time for questions for today. Just to leave with a comment that someone had shared in the Q&A. They had to leave early, but they say they now understand why Steve is a legend. Amazing and powerful presentation. Thank you so much. And so I'm just going to share a screen briefly to close us out for the night. So we have some McLean resources just to highlight some family support resources, peer support resources as well that could be of interest to folks. And then the Well Space program that Steve leads, which is wonderful and growing every year. I had already put a link in the chat, but this is a little bit about the description for their flyer, some example groups. So the group schedule might be evolving and changing right now to get even better for folks. And so in terms of closing remarks, thank you again for joining us. If you have feedback on what you liked, what you thought could be better, please let us know in our survey. And then I would just like to thank everyone who's made this possible, particularly our donors who have made this program possible. And our next webinar will be next month, July 11th on Thursday, 5 to 6 p.m. on motivational interviewing for loved ones with one of our colleagues from the Boston Medical Center. So thank you so much. If you have questions for me, please let me know. I'm at jmccarthy@mclean.harvard.edu, and I hope you have a wonderful rest of the night. And thank you again, Steve.
Thank you.